Hey everybody, my name is George Koch. I'm one of the PGY3s and the research resident right now. This is the Vanderbilt Urology Conference Room where you would have interviewed with us on a normal year and where we would have started our tour of the campus. We'll take you on that now. This is also where we do all of our educational conferences in non-COVID times. So, you know, for the future applicants that we're really looking forward to becoming Vanderbilt residents, get used to this room because you're going to be spending the next 5 years in here. This is the Department of Urology. It's where all of our faculty offices are. Other than conferences, we don't spend a ton of time here. Here's the beautiful resident research room. That's where I'm currently spending a lot of my time. A couple of computers for research, a couple of hardcover resources, and then our mailbox. So right here you can get a good view of a portion of the hospital. This is the Vanderbilt main hospital where most of our patients are. Helipad up there, we're a level 1 trauma center, so we get plenty of trauma. Across the Sky Bridge, you've got Medical Center East. Right now, that's where we've got our COVID unit, and on the first couple floors, we've got a same-day surgery center. So you can get a lot of the smaller cases where patients are out the same day or 24-hour ops will be over here as opposed to in the hospital. We've got a lot of Predator support. The NHL team here at Vanderbilt. The players come by the Children's Hospital a lot. Nice perk of the program is a lot of the attendings have tickets and a pool, and you go to maybe one game every year, a couple of years, which is a nice benefit. Another good shot of the hospital is at the Vanderbilt main hospital here, where most of our patients will be. Administrative buildings and the medical school over here on the right, and all the way back with the colorful windows is the Children's Hospital. Everything's very close. You never take call on the adults and children at the same time, but even if you were to, it would be a really quick walk. This is Pad, one of the places we get our coffee in the mornings. They don't open up as early as the cafeteria, but always good for a good cup of coffee. This part is just for me. All the urology patients are on the 9th floor, South Tower, so we're headed up to one huge advantage of having all of our patients in the same spot is that the nurses on 9 South are excellent as far as urology goes. We very rarely have issues with CBI or some of our urology specific order sets, which is great. And every once in a while, even in a pinch, you can ask one of them to put in a difficult Foley on a nearby floor, and it's not an issue. So definitely one huge advantage of the program is having kind of all of our patients geographically located with urology dedicated nurses. This is where we meet every morning to do our morning rounds. Teams are split up into rounding teams, so 1 or 2 residents per team will round up patients, and then we all come in here and table round as a group. Like I said, all of our patients are geographically located on 9 South, so it makes it pretty easy for everyone to meet here and discuss our patients. We go over any interesting imaging, and then we go down to the OR and start the rest of the day. All right, heading down from 9 South. Down to the operating rooms, which are located on 3. We've got an OR workroom there for the urology department. All right, so we're about to sneak through our PACU into the OR workroom. This is the OR workroom where we spend our time between cases. All right, let's head on over to the cafeteria. Cafeteria probably shouldn't be your reason to choose any residency, but food's pretty good. We get a pretty good portion of meal money to use on our call shifts from the department, and we've got sushi, a grill, kind of a knockoff boat leg, pizza, salad bar, so a good variety of things. through the back way to the clinic. All right. This is the urology adult clinic. Where you see your adult patients kind of intermittently throughout your 5 years. As a PGY1, you don't rotate in the outpatient clinic at all. PGY2, you have a rotation year. PGYs 3 and 4, you have kind of a mentorship model or an apprenticeship model. So you see patients with your specific attendings when you're on rotation with them. And then as a PGY5, you don't do any clinic at the adult hospital, only at the VA. So you pretty much just operate in that year. Crossing right now from the adult hospital to the pediatric hospital. There's not a rotation where you're covering adults and pediatrics at the same time. So this isn't necessarily a walk that you make for the most part when you're on call, but we do have a newborn nursery over in the adult side. So occasionally you will walk from peds to see a consult that's just been done. Behind me is the Vanderbilt Pediatric Urology Clinic. It's where you do all your peds urology for your residency here. You're here as a PGY2 and a PGY4, both for a total of 3 months. You get a great peds experience. It's very operative heavy. Even as the PGY2, you're operating at least 2 to 3 days a week. Peds clinic is great. It's the attendings are all excellent teachers, and you get a really good foundation in pediatric urology. We're just leaving the pediatric clinic now and heading over to the VA. This is the typical walk from the parking garage in the morning to the hospital to start your day off. You should sit actually probably a good view of everything. So Crosby Park in Children's Hospital, Vanderbilt Main Hospital, VA. So this is the VA. You rotate here as an intern, PGY2, a PGY3, and a chief. Essentially the intern, the PGY2 and the chief make up the service, and then the PGY3 is a little bit separate from the service, kind of doing their own thing. But you're here, at least once every year, except PGY4. You get a great surgical experience. The VA attendings are almost all fellowship trained, and the education's wonderful. One of my favorite places to rotate. Now we're gonna make our last leg, curling back from the VA to the Department of Urology. Welcome back to the research office. I hope you guys enjoyed your tour of Vanderbilt and got to know Vanderbilt Urology a little bit. Thank you to the attendings and the residents who offered their time unknowingly at first. If you guys have any questions about the program, our website's a great resource. Keep your eye on the Twitter, VUMC Urology or at VUMC Urology. We hope to see you at your booth.